Hi, my name is Theresa Castor, and I direct the Health Communication Minor and Certificate program that we offer in the Department of Communication at the University of Wisconsin-Parkside. So first, what is health communication? Very simply, it's the study of how people interact on or about health issues. Now, this can include conversations that people have about health. So when you talk with friends or family members about their own health, about your health and well-being, it can also include communication that is in health-related context. So for example, when you go see a doctor, for instance, or if you're a doctor or a nurse talking with a patient, those would be examples of health communication interactions. So overall, in health communication, the main purpose is to understand the relationship between health and well-being and how communication can support that relationship in positive and constructive ways. Also, an important aspect of health communication is considering how culture, diversity, and health communication relate. In other words, when we talk about health, it is in the context of understanding that different people, different cultures have different ideas regarding what is health and how to talk about and communicate about health and well-being. So in essence, somebody who studies health communication is developing their knowledge and skills on how to bridge the quote-unquote language of science, medicine, and personal or community well-being. In other words, it's not only about understanding the science and medicine related to health, nor is it just understanding about interaction and people and talking with people interpersonally. Somebody who studies health communication knows how to take information about health and make that understandable to people who might not be well-versed or as well-versed or knowledgeable in some of the details in the science of health communication. And vice versa, someone in health communication is someone who can help individuals who are specialized, who might be specialized in health communication, understand how to talk and interact with audiences that might not have the same knowledge or background. So why study health communication? Basically, it can help you learn how to facilitate communication between medical practitioners and the general public. And when I say this, it's also about from the perspective of if you are a healthcare practitioner, understanding health communication can help you communicate in better, more effective, and empathetic ways with your patients and clients. So some examples of areas where this is helpful is in doctor or nurse-patient communication, patient advocacy, or public health communication, which is, for example, what is occurring right now as we have this pandemic and as people, the general public, is trying to understand what's going on. Individuals who understand health communication are the ones who are trying to communicate about things such as what does the virus mean, what's involved with the vaccines, why should we stay at home, and so forth. So studying health communication is ideal if you want to work in a healthcare setting or if you want to work in an organization that helps people with their health. So what does the certificate in health communication consist of? There are 15 to 20 credits involved with the certificate. It includes a set of required courses, which are in the area of interaction through Communication 107, it's an introductory level class. Health Communication, COM 340, which is offered only in the spring, and the capstone course in Health Communication, COM 493. It's 1 credit, it's offered in the fall term only. In addition, you need to take a class, an elective course in healthcare systems, and there are 3 options for that in different programs, either in applied health sciences, health exercise science management, or the nursing program. And I will say with those electives, you'll need to talk with your advisor to figure out which one you have the appropriate background to go into. Third area is you need to take a course in biological science, and there are a number of electives in that course. And again, you'll need to talk with an advisor or make sure that you meet the appropriate prerequisites for the elective course you choose in biological sciences, and a course in chemistry. Again, there are a number of options here for you. So that's basically the health communication certificate. Now, the health communication minor is fairly similar, but involves more credits. It still has as the foundation a set of required courses in interaction, health communication, and the capstone. Still has a healthcare systems elective in biological sciences, an elective in chemistry. In addition, it requires that you take advanced coursework specifically on advanced message design, and there are a number of electives in communication or English that address this. Please make sure you are looking at the specific courses to make sure you take the appropriate elective and that you meet the appropriate prereqs. There's also a requirement for an elective course in what's called diverse human systems. So a number of courses that have you look at either diversity or culture or healthcare systems as organizations. And that's it. So if you have any questions about the health communication program, the minor or certificate, please make sure to contact me. My name again is Theresa Castor. Take care and goodbye.